A consultant physician and cardiologist at Central Hospital Ugili, Dr. Vincent Ofoye, and Dr. Christian Bassi of St. Stephen's Specialist Hospital Ugili have advised the masses to be mindful of the quantity and quality of diet they take in order to avoid diabetes. Speaking against the backdrop of the World Diabetes Day yesterday, they said it was important to watch their intakes because the main complication of diabetes is on the kidney. Quest Utiboturn has the report.
The theme for World Diabetes Day 2023 was Access to Diabetes Care. Dr. Vincent Ofoye revealed that General Hospital Ughelli has a clinic that is dedicated to diabetic patients and it holds every Thursday. He urged diabetic patients to exercise frequently and eat right.
We actually have a clinic that is dedicated. We have a clinic that is dedicated for the care of diabetic patients, which we started sometime late last year. And even from the little we have seen, that clinic has been increasing. But whatever we see here, I feel is still a tip of the iceberg because a lot of people are still not accessing care. So it's only the ones that we are seeing that we can, have statistics on. First of all, if you understand the nature of diabetes, we should actually aim at prevention first. Okay? Though there are some people with a family history that invariably they may come down with diabetes, but it's not always so. Okay? Now for diabetics, two ways that they have said that you can prevent getting diabetes through diet and also through exercising. And I think we need to emphasize those two things. Okay.
Both Dr. Ofoye and Dr. Bassi added that diabetic patients should undergo constant blood sugar check and seek medical advice from endocrinologists. Also, Dr. Christian Bassi, in a telephone interview with Quest News, said one of the best approach in managing diabetes is dietary.
When a patient is being managed for diabetes mellitus, patient is in the active phase, the patient is admitted into the hospital, we'll be given insulin, and then when the blood sugar is stabilized, it will be converted to oral medication. And then dietary approach is also a thing. These patients are advised to reduce the quantity of their meal, and they're supposed to eat small diet, balanced diet, more of vegetables, reduction in sugar intake. Normally, it's not actually the sugar, though the problem here is sugar, no doubt. But then they can take these meals, rice, and the rest of it, but in very small quantity. The mistake people make is not eating their normal diet because they have diabetes. A diabetic can eat normal diet. The advice is on the quantity. So small diet. Then constant blood sugar check, daily fasting blood sugar, so that you know if you are doing well or not.
He stated that diabetes can coexist with hypertension and advised diabetic patients to seek medical help rather than self-medication.
Diabetes has complications, and the main complication of diabetes that are really dreadful is the complication on the kidneys. So a patient that is diabetic has to be visiting the endocrinologist, who is a specialist in this aspect of medicine, to have consultation and be reviewed, especially the drugs, because diabetes can coexist with hypertension and other diseases, which, if not managed collectively, will affect the patient's life as a whole generally.
Utube Otun for Quest News.